focus a lot on metastatic breast cancer research because metastatic breast cancer is responsible for the majority of breast cancer related deaths, and people with MBC desperately need more treatment options. But research on early stage breast cancer is just as important. We asked Komen scholar Dr. Sarah Tolini to explain to us why.
Research in early stage breast cancer is, in my mind, very critical because this is how we can help cure patients. So if we can get rid of the cancer when it's found early, we can prevent that cancer from coming back. And that is really critical. And so to me, that's probably one of the most important things that we can do is really to try to cure more patients and prevent patients from developing metastatic disease.
Early stage estrogen receptor positive breast cancer is actually the most frequently diagnosed type of breast cancer. And the good news is we are very good at treating it. In fact, the 5-year survival rate for estrogen receptor positive breast cancer that's confined to the breast is 100%. But as we heard from Tracy, there is a risk of recurrence, and this can persist for decades. We asked Dr. Tolini why patients with early estrogen receptor positive breast cancer need more options.
So, for a patient who has a hormone receptor positive breast cancer, generally we know that hormonal therapies are therapies that will either decrease the amount of estrogen or block the estrogen, are very highly effective treatments. And for some patients who have hormone receptor positive breast cancers, chemotherapy can also be helpful in trying to kill any cancer cells that could be left behind, for example, after surgery. But we've learned that not all cancers are the same biologically. And so that means that some cancers, for example, are going to be very sensitive and get easily killed by some drugs, whereas other cancers may not be as sensitive to the treatments that we give them. And we've come a long way where we've tried to develop ways to personalize therapy to the individual tumor. And in fact, have even learned how to send what we call a genomic assay to figure out which cancers may be sensitive to chemotherapy and which ones may not benefit from chemotherapy. But despite getting here and knowing how to utilize chemotherapy and hormone-based therapies, there still can be some patients who recur after having an early stage breast cancer, even after getting all those treatments. And to me, that means that we need to figure out better ways to treat these patients, and that thinking about what other therapies could help reduce that risk of recurrence is really critical.
Dr. Tolani shared some of the most exciting new advances for people with early estrogen receptor positive breast cancer.
It has been a really exciting time because we have seen several new therapies come out for early stage hormone receptor positive breast cancer. One type of treatment that I think has been really exciting for us to see come along is the use of what we call CDK4/6 inhibitors. So these are pills that can be given in addition to the hormone therapy for someone who has a hormone receptor positive breast cancer. And basically, what this pill does is it's really trying to stop the cell cycle. So, you remember maybe from biology classes where we learned that cells like to make copies of themselves. This drug, the CDK4/6 inhibitor, is not letting the cell make another copy of itself. So, it's sort of halting that cell cycle. So, in essence, if the cell can't replicate, it sort of falls asleep. And then, hopefully, when the cell's asleep for a really long time, it eventually dies. And so we've learned that when you add this pill to a hormone pill, it actually works synergistically. So it makes it work even better at killing the cancer cells. And there is a drug called abemaciclib. The brand name for this drug is Verzenio. And it was studied in combination with hormone treatments that were given to patients who had what we consider higher risk hormone receptor positive breast cancer. So breast cancers where there was lymph node involvement. And patients got their usual hormone therapies, but in addition to that, got 2 years of the abemaciclib added on. And when they did that, we saw that the patients who got the abemaciclib had a lot fewer recurrences than the people who were not getting the abemaciclib. And in fact, it reduced rates of recurrence by about a third. So it did seem to be a significant benefit for patients. And so it is a drug that we now consider adding to someone's hormone therapies if we think that their cancer is a higher risk cancer. And again, we would give that pill for 2 years in addition to the usual 5 to 10 years of the hormone pill. There's also another CDK4/6 inhibitor where we've seen more recent data come out. It's called ribociclib. This drug was studied in a trial called the NATALEE trial, where they gave 3 years of the ribociclib in addition to the hormone pill, and found that with the 3 additional years of this ribociclib drug, it reduced risks of recurrence by about 25%. The data is still a little bit earlier on than the data that we have from the monarchE trial, which was a trial that had studied abemaciclib. So it's not quite as mature, and we need to follow patients a little bit longer, but clearly also is showing a significant reduction in risks of recurrence. And so I think really important to see that we are making headway and that CDK4/6 inhibitors can help reduce risks of recurrence. So while we've seen new drugs come about like CDK4/6 inhibitors for hormone receptor positive disease, we haven't seen new endocrine drugs in the early positive breast cancer space for over 20 years. And so this is an area where I am excited because there are new drugs that are in anti-estrogen drugs in essence. So there's a new class of drugs that we call oral SERDs. And in essence, what these drugs do is they degrade the estrogen receptor. This is different than drugs that we typically give for early stage breast cancer, like an aromatase inhibitor, which really is working to get rid of the estrogen in a woman's body, whereas tamoxifen doesn't really allow that estrogen to stimulate the estrogen receptor. These new oral SERDs actually just chew up the estrogen receptor and don't allow it to signal. So it's a different mechanism. And for patients who have metastatic hormone receptor positive disease, we're seeing really exciting data that these drugs may be better than some of our standard hormone therapies. And so there are now trials exploring these oral SERDs for patients with early stage hormone receptor positive breast cancer. There are also other therapies that are getting explored to see if they too can help prevent recurrences. And one category of treatment that I think is super exciting is using what we call immunotherapy. So this is a type of treatment where, in essence, what we're trying to do is stimulate the body's own immune system to kill the cancer cells. And we've seen that this can be highly effective in some types of triple negative breast cancers. And so the idea was, could it also help hormone receptor positive breast cancers? And so there's some recent data that suggests that if you add immunotherapy to chemotherapy in patients who have high grade hormone receptor positive breast cancers, that we were seeing that if it was given prior to going to surgery, that the number of patients who had all their cancer gone at the time of surgery was a lot larger number of patients than compared to the people who just got the chemotherapy alone. We do need to follow these patients longer, though, to make sure that the immunotherapy is also preventing recurrences. And so we will need a little bit more time to see if that's the case. And if that proves to be the case, then this could be a treatment that we could consider for patients who have higher risk hormone receptor positive breast cancers. But I think, again, we need a little bit more time to flesh that out, but really exciting to see that these agents are moving forward.